Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Ali Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can stream our shows daily on our YouTube page at youtube.com/Muslim Network TV and on our website at muslimnetwork.tv. You can also find us on Roku TV, Apple TV, Galaxy 19, and Fire TV. In today's episode, we're going to be talking about another joint disease, and this time we're talking about gout. Joining us in that discussion is Dr. Mohammad Ursani. Dr. Ursani obtained his medical degree at Ross University. He completed his internal medicine residency training at the Seton Hall University School of Health Sciences program in South Orange, New Jersey, where he was also chosen to serve as chief resident. He then pursued his fellowship training in rheumatology at the Baylor College of Medicine in Houston, Texas, and currently practices in Houston, Texas. Dr. Ursani believes the practice of medicine goes beyond the clinic or hospital, and he aims to improve the overall healthcare system and advocating for his patients by playing leadership roles in various academic and public health organizations. Welcome to our show, Dr. Ursani. It's such a pleasure to have you here today.
Oh, thank you. Walaikum salam, and thank you for having me. I appreciate the opportunity.
Absolutely. We recently had a conversation about joint disease and we talked about arthritis, but our guest that day did mention inflammatory joint disease. And this is where today we're highlighting gout as one of those, one falling under that umbrella. So for people who have not suffered from gout, they're very lucky because it is a very, very painful disease that patients will come to me, and it's something that, you know, when people talk about pain, sometimes they can't remember when it started, but when it comes to gout, they can tell you precisely the moment that they remember that the pain flared up for them. And so today's conversation is about that. Let's start by defining or explaining to our audience what gout is.
Sure. So interestingly enough, gout is actually derived from a Latin term named gutta. Okay. And so what that translates to is a drop. And so back in, the 11th, 12th, 13th century, what they used to think was that there was a drop of evil affecting a certain joint, which is why people had so much pain.
Interesting.
Right. And so, obviously when modern science kind of came into the picture, they realized that it wasn't any evil spirits causing it. It was actually a disease that's being caused by the deposition or the collection of a certain type of crystal, which is based off of uric acid. And when that crystal kind of deposits into the joint, it causes a lot of irritation and pain and inflammation. And people generally come to you or me or any other physician, with the complaint of just severe pain.
That's really interesting. I didn't know the history behind it, but that's really interesting to know. And it's not evil, maybe a little bit in the food that we're eating that can cause it, but not true evil. So share with us a little bit about the incidence. How common is gout?
So you had mentioned inflammatory arthritis. And so it's actually the most common form of inflammatory arthritis. In the United States, more or less, it affects about 5% of the population, which sounds quite small, but it comes out to around 8 to 8.5 million individuals. Generally, men have the twice of a risk factor of developing it. It's about 6% of men and about 2% of women. And then the risk of it occurring increases as someone ages. And so someone that has is say 80 years old has a higher risk significantly than someone who's say 25. Interesting.
And so is the risk because as we age, it becomes cumulative, or, do we know why it's higher as we age?
So that's a good question. There's different theories behind it. One theory is that once we age, like you said, we have an increased amount of uric acid, which is what those crystals are composed of, kind of back up into the body and accumulate. And then another theory is that sometimes as we age, as we'll discuss, I'm sure in the talk, there's people that are older have a higher risk of things like obesity, high blood pressure, diabetes, metabolic syndrome, which can all contribute to the accumulation of high uric acid again.
Okay, that's interesting. Since you did bring it up, let's talk about risk factors. So you mentioned obesity is a big one, and this keeps coming up over and over again in a lot of these episodes. As I always say, we talk about prevention a lot, and getting weight under control is a big part of that, a big part of the discussion that all physicians have with many patients with chronic disease. And then you mentioned as well, age, as you said. Let's go into a little bit more detail about other conditions that may put someone at risk for a higher risk for getting gout.
Sure. So interestingly enough, those conditions actually put someone at risk for high uric acid.
Okay.
And so a lot of the times a high uric acid does not necessarily mean gout. There's a gap in knowledge that we have there of why certain people that have high uric acid levels never develop gout. And there's some people that have high uric acid levels that eventually do develop gout, but we're not entirely sure of why that happens or what or why some individuals have an increased risk of that actually flipping into it.
Interesting. Okay. So talking about those other, risk for, uric acid rather than gout.
Sure.
Well, actually, that's really hard to say because just like you said, even if they do have high uric acid, it just doesn't necessarily mean that they would be at risk for getting gout. So that's kind of a difficult, it's difficult, I feel, to counsel people then in that case, right?
Sure. It's difficult to counsel, but we do know some of those risk factors like you had mentioned. And so controlling those risk factors will help inadvertently reduce the risk overall, even if someone is not geared to develop gout, theoretically. Aside from obesity and high blood pressure and metabolic syndrome, interestingly enough, a lot of medications that people commonly take also can increase those uric acid levels. So medications for high blood pressure like diuretics, or people know them as water pills, even aspirin or cholesterol medicine like statins, they can all increase the uric acid count in individuals. And then also there's other conditions like rheumatoid arthritis, which are treated with medications like leflunomide. That's also known to cause increased risk of gout. And even certain Parkinson's drugs, which are like it's a neurological condition, a type of dementia or a movement disorder. Some of those medications are also known to cause high levels of uric acid. And then lastly, very commonly, I see patients that are on some type of chemotherapy. Because of the way chemotherapy works, it destroys those cells, or the bad cancer cells. And when those cells get destroyed, it releases a lot of purines or the precursor to uric acid into the bloodstream. And again, that raises those levels as well. So oftentimes people will have, people who've never had a gout flare, once they get on chemotherapy, they can very likely develop gout just as long as they're on chemotherapy. Once that stops, it kind of resolves.
Okay, interesting. So you mentioned two big terms or chemical terms now, purines and uric acid. And so, as you said, gout stems from the deposition or collection of uric acid in joints, and that comes from purines. Let's go back even further. Where do purines come from? How does somebody, how does that come to be in somebody's body in order to develop gout?
Sure. So, purines are basically chemical structures or the building blocks of DNA and RNA. So generally, we all have purines because our DNA and our other genetic material is made up of it. There's other ways that we can get additional purines into our body, and which kind of break down into uric acid. And those can come through various types of foods. They can come through various types of drinks as well. So in terms of drinks, I mean, I know this is for Muslim News Network, but alcohol or beer specifically and liquor are the two most common reasons why people develop gout or high levels of purine or uric acid. And then also, interestingly enough, there's anything that has high fructose corn syrup. So generally, when most people don't read labels of the groceries and the drinks that they buy, but high fructose corn syrup is basically a cheap version of sugar. And unfortunately, it's in a lot of things. So when you go and buy orange juice or fruit punch from, a grocery store, when you read the ingredients, it's actually 10% juice or less than that, and 90% high fructose corn syrup. So the consumption of that will also increase the uric acid levels as well.
That's a really good point that you make about the juice. Sorry to interrupt, but yes, absolutely. Reading food labels is so important for that very reason, right?
Correct.
The definition for juice is, I think, subjective.
Exactly.
Make sure you turn it around and you look at what actually is in there is really important. But I didn't mean to interrupt you. Please continue with other examples.
Yeah, no, and in terms of like foods that people eat, it's a lot of the times it's in red meats, or specifically organ meat. So if people are eating liver or kidney or just red meat in general, that has high levels of purine in it, or a high level of uric acid that can potentially come from that. Certain types of seafood even. So generally I tell my patients bottom feeders, right? So shrimp, lobster, crab, anchovies. In terms of, fish like tuna, salmon, anchovies, you can eat those in moderation. But I think too much of that can also have a high purine count. And there's some individuals I know, Muslim individuals that love eating duck. So duck is also a potential trigger. Yeah, right. It contains a high purine count as well.
Interesting. Okay, I did not know that about duck, but it is. I think the meat is, well, a lot of times when people eat duck, they do love to eat the liver too, right? And so, as you said, that's organ meat that can trigger that. Interesting. So now that we have an understanding of where purines come from and how it kind of develops into possibility of a gouty attack, let's talk about what an attack looks like. What are the signs and symptoms? We mentioned pain. That's one of them. But let's go into a little bit more detail about what that looks like in terms of how it affects the joints.
So you kind of mentioned it, and you were dead on with the way you described it, where people will tell you exactly when it happened, what they were doing, and because it's the onset of it is very quick. So it typically involves a single joint. It can involve multiple joints as well, but typically it's a single joint. And interestingly enough, it's usually a joint that's away from the spine or away from the core. And there's a reason behind that. If you read, textbooks, they'll describe a term that's called podagra. It's Podagra, and that is defined as gout involving the first big toe of the foot. And the reason why that happens is because this uric acid, as we mentioned earlier, it crystallizes, but usually crystallizes at low body temperatures. So very often people will say that they wake up in the middle of the night with pain. It'll be in the big toe. Because when we sleep at night, our blood flow restricts to our organs and while we're sleeping, just to keep the organs warm and healthy. But a lot of the times our hands and our feet will go cold, and the temperature will be quite a bit different from the core. So it's very rare for someone to say they have gout in, for example, their collarbone, or a gout in their spine, or their SI joints in the back. When this occurs, the pain lasts for anywhere between 7 to 10 to maybe 14 days. And interestingly enough, if we do nothing about it, if that individual does absolutely nothing about it, it will resolve on its own after that period of time, which is quite different than other conditions like rheumatoid arthritis or other autoimmune conditions, basically.
While it can last that long to resolve, very rarely, I'm sure, do people let it, because the pain is just so severe, do they let it just kind of drag on for that long?
I've had patients tell me that they don't want to wear socks. I've had patients tell me they want blankets off their feet or off their knees when they swell up. It's a very common reason of calling out for work or disability. So it's definitely, I can't understate the amount of pain that people have with it.
And I would have to agree with you for sure on that. As you said, even something as light as the sheet, like just a light sheet on their foot, is really, really uncomfortable to them. And so we're going to talk about what can be done, how this is managed. But before that, we do need to take a quick break here. So we're going to do that. You're watching What's Up, Doc, on Muslim Network TV, and we'll be back after this short break.
If I could be you, and you could be me for just 1 hour. Walk a mile in my shoes. Walk a mile in my shoes.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Right here, baby. Look. Uma.
¿Cuántos años tienes?
Noah.
Something more than a birthday is happening here. Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Assalamu alaikum and welcome back to What's Up, Doc. Joining us today is Dr. Mohammad Ursani, and we've been talking about gout. So before the break, Dr. Ursani, we were talking about a lot of the different things that lead to gout, some of the foods, et cetera, and things like that. And we're talking about the signs and symptoms. So when a patient comes into your office with what sounds like gout, walk us through what you do to confirm the diagnosis and then treat that.
Sure. So it can be 2 different ways. So one is someone comes in and their joint is swollen. Mm-hmm. So the gold standard to diagnose is actually aspirating the joint, which is basically withdrawing fluid from the joint, whether it's the toe or the knee or the wrist or whatever joint is being involved, and looking at that fluid under a microscope to actually look for those crystals. And surprisingly enough, it's a very kind of a cool diagnosis to make in terms of rheumatology, but it's very satisfying.
Is it because you can actually see the crystals under the microscope, right? Is that
so you
why?
can see the crystals under the microscope, and once you pull the fluid out, someone feels so much better because you're relieving all that pressure and angry fluid that kind of builds up there, in the joint.
So it's diagnostic and therapeutic.
Right. Yeah. If that's not the case, where they say they had the attack last week or the week before, and by the time they see me, they're feeling better, or they're over the episode. Then it comes down to history, right? So you had suggested that someone comes in with kind of an acute onset of pain where it occurs and kind of climaxes very rapidly. And usually there's a trigger. Someone will say, I was at, a friend, I went to dinner with a friend and I had, fried shrimp, or I was at dinner and we had steak, or we had, for the non-Muslim patients, they had a few drinks, and that's when it flared. Some patients will say that, my cardiologist or my primary care doctor put me on a water pill. That's the only new medication I'm taking. And then that's when I noticed this coming. So a lot of it is history taking. If it's that second group where we don't have that gold standard diagnosis of looking at the actual crystals, one method to help with the diagnosis is checking that uric acid level that's in the blood. Another way, in all my patients, I get x-rays of the joints that are involved. So if it's the hands or the feet or the shoulder or the knees, because the way gout looks on x-ray, especially if there's repeated episodes, it will actually eat away at the joint and destroy and damage the joint permanently. And it looks very different than, say, rheumatoid arthritis or osteoarthritis or psoriatic arthritis and these other conditions.
Interesting. And so with that damage that you described, does that happen originally with the initial attack, or are you talking about over time that we would see this?
So it's very, very rare to have it as an initial attack. But there is a period in which joint damage can be occurring, but clinically the patient does not feel it. And then they just hit a theoretical threshold, and then that's when they have the flare up. So I've seen, very rarely that joint damage is present in someone who reports it's their first episode, but it's very rare. It's usually from repeated episodes, and that's more of a reason to kind of manage it and stay on top of your lifestyle modification to help control that and not cause permanent joint damage.
So it sounds like it's really important that if you're having this, and let's say somebody suffers from gout and they're managing it with at-home medications, over-the-counter type stuff, long-term, it's still important to get care and help for that, because there is that long-term erosion or damage in the joints that can lead to chronic problems for an individual. So it's still important to come in and see your doctor for this, correct?
Correct. So it's not even, if you're talking long-term, it's not only about the joints. So people that have gout that's uncontrolled, they have a high level of inflammation throughout their body. And so that high level of inflammation increases risk of things like cardiovascular disease or heart disease, increases risk of kidney disease, increases risk of kidney stones from developing. So it's not only a matter of the joint per se. It can be a systemic effect on the body if it's not managed appropriately and it's not looked after pretty thoroughly.
So since you led us down that path, let's talk about management. What does that look like once you've cinched that diagnosis or confirmed it? What are the next steps when you have that discussion with your patient for treatment?
Sure. So even management, there's different facets to kind of look at. If someone is walking in, as you mentioned, with a swollen up joint in my clinic, and the way to manage that and to treat that episode is do my best to withdraw the fluid from the joint and usually inject it with some type of anti-inflammatory. So we use cortisone or steroids and variations of that to help alleviate the pain. If the joint is not able to be aspirated, or the joint's not able to be injected with this fluid, we could even use oral steroids, things like prednisone or methylprednisolone are the two common ones. And then there's also another medicine that's called colchicine, which is also specifically for gout. And lastly, you can use non-steroidal, so things like ibuprofen and its derivatives or things in that family to help alleviate the symptoms. It's not one is ideal over the other. You just have to look at the risk factors of the patient and choose the appropriate medication. So that's for the acute phase. To maintain it long-term, we use other medications that help lower that uric acid count in the blood. And they act by basically acting on different parts of the kidney to help push that uric acid into the urine and out of the body. The most common medications that are used for maintenance are medications like allopurinol, febuxostat, and if you and probenecid, and then if it's very resistant disease or very aggressive disease, or they call it tophaceous, which means these uric acid clumps kind of develop under the skin throughout the body. We use medications like pegloticase or anakinra, which are either injections or infusions, to rapidly lower those uric acid levels.
So, sorry.
No, and then aside from medication, the very important thing is diet and lifestyle, right? So
before we move into diet and lifestyle, I definitely want to summarize what you've shared, because there were a lot of big names that maybe our audience are not familiar with, but people who may have gout, they might benefit from sharing this with their doctor. But in the broader overview, it sounds like there are two kind of classes of medications for treatment. One is for the acute flare-up, so for the pain and to help with the flare as it's happening or within days of an attack. And then there's a second category of medications where you're trying to lower that uric acid and help prevent those flare-ups from happening as frequently. They may not completely take away all the flare-ups altogether, but they may help reduce the frequency. And then you mentioned some other medications, including injectables, but that also is included for really severe disease. Did I summarize that? Okay, perfect. Perfect. No way. However, I am, as a family practitioner, used to kind of having to really bring it down. So next, we're talking about prevention and lifestyle, and that's really important. So let's talk about that as far as, okay, in addition to, or maybe if somebody's not ready to start medications, things that they can do on their own, changes that they can make to help. Okay, take it away.
So one thing before I discuss the diet and lifestyle, one thing is just to go through your medication list with your doctor. So either your primary care doctor or your cardiologist or whoever that's, whoever's prescribing the medication that you feel like maybe the culprit in terms of your attacks. Just discuss it with that physician and the possibility of using an alternative therapy. In terms of modification of lifestyle, biggest thing is obesity. So if one can work on weight loss, that significantly helps reduce that uric acid level that's in the body, and inadvertently will reduce the gout flare-ups on its own. In terms of diet, I recommend, there's two different diets that I recommend individuals to try their best to abide by. One is a Mediterranean diet, which is, a lot of cardiologists love this diet. I'm sure, Dr. Abawani, you like the diet as well for your patients. So it's basically a very clean, light diet that focuses predominantly on, vegetables, fruits, nuts. You eat chicken, and dairy products and eggs in moderation, but you rarely eat processed meat or red meat. You rarely eat high sugar loads, such as even energy drinks, to be honest with you. That's another drink that I didn't mention before. And then the second diet is the DASH diet, DASH, which stands for Dietary Approach to Stop Hypertension, which is high blood pressure. So the DASH diet, again, is very similar to what a Mediterranean diet is. So it's a diet that's rich in vegetables and fruits, whole grains, very low in salt, very low in processed foods, and then full dairy products as well. So, in terms of modification of lifestyle, diet is very important. Weight loss is very important. And if someone, does drink alcohol, then either switching to wine or really avoiding the beer and liquor altogether is probably the best way to go about it. And then, interestingly enough, they did a study which showed if the modification of diet alone was enough to reduce the gout flare-ups. And unfortunately, the general consensus was that it's not. It can only drop the uric acid level by 1 point or so, when most of the time people need to drop it by as many as 5 to 8 or 9 points. So in addition to diet, it's important to comply with your medications and make sure that people are taking that pretty regularly as they should.
Excellent. That's good to know. I didn't realize, I mean, while every bit counts, right? Every point counts. I didn't realize that the diet was not as big as impact as taking medications. Now, just really out of curiosity, because exercise seems to help with everything,
Yeah,
a lot of chronic conditions.
Sure, yeah.
Does exercise have any impact on gout?
That's a good question. So with exercise, so one of the things that can flare gout is any type of physiological stress on the body, because that can break down purines and increase the uric acid level, essentially. So when someone is exercising to a level that they're used to, I think it's generally okay. But when someone goes and tries to run a marathon, when they have not run a marathon before, or have not run anywhere near as close to that, then that can actually put a stress on the body and may potentially increase the uric acid count.
Okay, good.
So that's a good question. But I'm not discouraging people from exercising.
Yeah.
Exercise.
Exactly.
Yes, you should exercise.
Exactly. And then I'm going to put this out there. I didn't set you up for this, but I do also do obesity and weight loss, right, as part of my practice. And so if you have any patients who are looking, shameless plug, send them my way. Happy to take care of them. I found that with family medicine, like I said, I find that a lot of my conversations revolve around talking to them about weight loss. And after doing my board certification in obesity medicine, just there's so much information that we don't learn in medical school or in residency that would really help our patients to lose weight.
Absolutely.
With that being said, thank you so much, Dr. Ursani, for today's conversation. It was just very enlightening. I learned a little something, a little bit about the history of gout there in the beginning, so that was really great to hear. And we wish you every success in your future career.
Jazakallah khair. Thank you so much for the opportunity.
Thank you again. We hope you enjoyed today's episode, and we thank you for joining us on another episode of What's Up, Doc. I'm your host, Dr. Alia Barwani, and you can find us on our website, at muslimnetwork.tv, or on our YouTube page at youtube.com/Muslim Network TV. I'll see you next time on another episode of What's Up, Doc.